we've been talking to physicians, to people in the different areas, but let's talk with somebody who works in education field. Dr. Tia Collins, who is an assistant professor in the Black Youth Studies program at the University of Ottawa. Est-ce qu'on peut accueillir notre modératrice, s'il vous plaît, Dr. Tia Collins, en applaudissant? Merci.
The mic is on. I always wanted to say that. Okay, so we're in our last panel, looking out. Thank you so much for staying till the very last panel, for demonstrating your dedication. So I'm gonna get right into it. I'm going to introduce our first panelist today, whose name is Dr. Loydie Jerome-Majewska. She's a professor in the Department of Pediatrics at the McGill University and a senior scientist at the McGill University Health Center. Her research aims are to improve our understanding of the genetic and cellular mechanisms that regulate embryonic development and to identify how genetic and environmental insults in utero contribute to congenital malformations. She is a fellow of the American Association for Anatomy and the 2023 recipient of the Anne McLaren Award for Outstanding Women in Developmental Biology, recognizing her pioneering work on craniofacial syndromes and placenta biology. And she is also a co-founder of the Canadian Black Scientists Network and the current chair of the board of directors. Please welcome Dr. Majewska. And I hope I said that right. Thank you.
I want to say how impactful today has been. I've learned a lot, and I'm really excited that so many of you have stayed behind, because for me, the one thing that I would like to transmit to everybody in this room who is coming up in the field is that you control the data that will control our health. If you can do the research, then you change the textbooks. And to do the research, you need to get money. And to get money, you have to attack the system. It's a multi-pronged approach. You can't do it from one corner. You have to do it in many different ways. And so what I'm hoping to do today is to talk about some of the inequities that exist, but also I want to leave you with the idea that we have no choice but to try and change this. And the way that we do this will depend on coming together as communities. I heard somebody talk about opening doors. It means that when you open, a door is open for you, that you leave it open so somebody else behind you can come through. And eventually that door will have to stay open. We also have to be careful how we do this. We cannot do this in a piecemeal approach where some idiot can come in and just say, that's it. We're not supporting this anymore. This has to become a way that a system change. You have to change a system if you want to get to where we need, which is where Black people, with the full diversity that we have, we get to enjoy life, do the work that we want, and we're not functioning because of trauma. Okay, that's not how we're supposed to be living. We're supposed to be living and enjoying our lives, and the way to do that is for us to make sure that we, the people like me who are at this age, we leave the door open, a little more open than when we found it, and the next generation do the same, so that our children someday are able to live the full life that they want, following the pursuits and happiness and joy that they want to do, not trying to fix something that they didn't break. So, I still don't have slides. But I wanted to say that. Am I going to have slides? No? Oh, okay, great. So, I'm just going to go ahead and start because there's drinks coming and I don't want to be between you and your drinks. So the first slide is really a historical landscape analysis, right? So there have been some studies looking at the funding environment here in Canada. And I have to disclose that I am part of the system that reviews funds. I am not speaking for funders. I am not speaking for McGill. I'm speaking for myself, okay? So research on the health of Black communities receives only a marginal share of public and private funding. Calls for proposals are too broad. There's no race-related criteria or requirements, which makes specific needs quite invisible. Programs targeting Black health populations, programs targeting the health of Black populations remain rare, occasional, and underfunded. Black researchers and allies face a double disadvantage. There's less access to institutional networks and resources. There's less recognition of the scientific value of their research topics. And in Canada, underrepresentation is amplified by the absence of race-based data in grant reporting. So what that means is that the lack of funding is not coincidental. It's a structural consequence of institutional racism in research. So Black researchers are less likely to obtain CIHR funding than their white peers with comparable records. And a couple of years ago, I actually had an interview where I talked about this. Because if you cannot get funding, you cannot do research. And if you cannot do research, you cannot have Black researchers, right? And so this is a problem for people doing science that's not even just related to Black health. So I'm a fundamental biologist. My work has implication for every baby that's born. But if I can't get funding, then that means that the work that I do is not going to be supported. So you can imagine that projects that address Black communities, racism, social justice, or community health are going to be viewed at even lower levels. Review committees and these people are doing the best that they can, but they don't have the training. They don't appreciate the system that Black people are navigating. And so this leads to a cycle of exclusion. Less funding, fewer publication, reduced credibility, less funding. Guess what happens if you haven't had funding for 6 years and you resubmit? Well, you're not gonna get funding because you need funding to get funding. It's crazy. That's how the system is set up. The more successful you are, the higher the chances are that you will get funding. So if you fall off, it's like falling off a crevice, right? So you have to have support from your institution. And so I have to tell you, quite honestly, this has happened to me. And I'm here because I got support at the Research Institute. $10,000 so that I didn't have to kill my animals, so that I can continue my research. Okay? So, why is the review process excluding Black researchers? Well, as you might imagine, in this room, I was telling somebody how happy I was to be in this room. When I was doing my studies, if you had told me that there was going to be a time when I would be in a room with Black professionals, researchers, clinicians, scientists, I would have laughed. Because I was the one in my PhD program, I was the one in my postdoctoral fellowship, I was the one going into the building at McGill 20 years ago. So this is amazing, right? But that means that the people who are reviewing the grants don't have the training. They don't understand what the problem is, right? So it's not just implicit bias and normative criterias, it's the fact that people are acting with what they know. So we have to educate the people who are reviewing our grants. Community-based participatory research proposals are often deemed methodologically weak without acknowledging the social relevance. So I think about that, and to me, I think about some of our social scientists, people like Isabel Wilkerson, whose work actually matters, right? So we know these people, but we need the larger community to know. So there's a lack of diversity in committees, and so you can imagine if you have a committee where you can now include more Black people, you have a chance. But we're still at that place where there's one person on that committee. How much power does one voice have when there's 19 screaming down at you? So we can't do it alone. I've heard people say we need allies, right? So we have to address all of these insufficiencies that makes it so hard for Black researchers who are addressing Black health or systematic for their research to be more valued, so that it's no longer systematically undervalued. So I did a quick search. Sickle cell anemia, first described 1902. Cystic fibrosis, 1938. How many publications on sickle cell disease, anemia do you think? 30,000. How many on cystic fibrosis? 62,000. All right? So why is that? Well, if it matters to you, you're going to do the work, right? And if you're not in the room, the work is not going to be done. So the consequences of underfunding on research doesn't affect just our community, but it affects, I think, society in general, right? So there's an impoverishment of scientific knowledge on racial issues. There's a marginalization of Black health experiences with research and policy. There's a perpetuation of systemic blind spots in public health policies and practices. So on the Black researcher, it means that there's this emotional burden that's carried by Black scholars and communities where you're fighting to be seen, fighting to matter, fighting for people to understand that the work that you're doing is important. There's an isolation and difficulty in career and advancement because you're trying to convince people who don't see a problem that there's a problem, okay? Discouragement and departure has happened to too many Black researchers. We need researchers. We need you to stay in the field. And this cycle leads to people leaving. But it also impacts the community, right? So you have fewer adapted health programs. There's a lack of evidence to change policy. We hear that if you have the evidence, you can push. But if you have nothing, it's very hard. There's a loss of trust in research institutions. Well, we've seen it happen in hospitals, right? People don't go in, even if they're feeling very sick, because you go based on the experience you had. If you went in the last time you were in crisis and they told you that you're seeking drugs, you're not going to go back in. So it's the same idea, right? There's a loss of trust in institution. And for me, one of the losses that's not on here is what happens to our students, our Black students who are interested in science, who goes into rooms and rooms after rooms and never see a Black scientist. I once received a note from a student 5 years after she graduated from McGill. She said, "You were the first Black science professor I've ever had." And it was impactful. I didn't know that going to that room. I was just sweating it out that I needed a grant. But we need more people in the rooms. You matter. Your work matters. So without equitable funding, there is no innovation, no justice, and no real public health. And I'd like to stress that this impacts society, not just us Black folks. So what do we need? CIHR and other agencies must publicly acknowledge these inequities, implement targeted funding initiatives. There are some for Black undergraduate students. There's the USRA, take advantage of it. There are some for master's programs and for postdoctoral fellows. You must promote community-based participatory research, calls that integrate the principles of undoing racism. We've heard it, Black anti-racism, we've named it. Now it has to be undone, okay? Provide training for reviewers on racial bias and racism in science. There's nothing worse than people saying, well, it doesn't exist because we look for the best. Well, if you look for the best, there would be a lot more of us in the room. And if we were in the room, you wouldn't be, if we weren't excellent, you wouldn't be so scared when the doors open a crack. That's what I think about that. So thank you. We have to systematically track race-based data on grant applications and success rate. We've started doing that. We have to keep doing that. I know it's a fight, but we have to continue. And we have to expand targeted initiatives that address Black health. For example, Public Health Agency of Canada's Black Mental Health Fund. So, measures to consider. Mandatory anti-Black racism training for all review committees. collection and publication of success rates by race and by research theme, creation of dedicated structural funds for research on Black community health, systematic inclusion of community-based researchers in review panels, integration of epistemic justice principles into scientific evaluation criteria. That is the least that the society can do for a group of people that have been sat on for so long. And so I will end here. Thank you.
Thank you, Dr. Majewska, for that powerful presentation. I will now invite Dr. Etowa to give the final presentation of the evening.
Thank you. So our final presentation of the day would be on data governance. 3 years ago, we got a SHRC-funded grant, Social Sciences and Humanity Council of Canada grant to look at research partnership, data governance, and knowledge mobilization in the Black community across the country. We've just finished data collection. We're now analyzing. So this will not be specifically giving you that result. We're working on it. We had an Emancipation Day event that we did in August, but expect to see that coming up in the literature very shortly. Data, the new power. Yes, data can be used for making powerful decisions, for allocating resources. And so we know what it means when we don't have that data. Health data is an intangible capital with real world power. But who owns Black health data? Yes, now we're collecting race-based data, but who owns it? Who is managing it? Who's the steward of this data? We need to, this is the time for us to think about that. What's our role in that data? So the central argument here is without equitable governance, data then reinforces the very inequities it claims to reveal if we're not part of governing it. So data as capital. Data is a strategic asset in health systems. It holds economic, political, and symbolic values. Black health data frequently is collected but rarely controlled by Black community members. And so it's an integral part of the discussion we're having today, how we can manage and be, thank you, how we can manage and be part of the stewards for this data. The impact of data. It improves the life of racialized people in Canada, not just the Black community. It prevents premature death, improves access and quality of care provided. We've talked about the different things that having control of this data can do for us. So I'm not going to, we've talked about it throughout the day, so I will not read each of these because I know you're just waiting for the one to leave this place. So having better governance of health data is an important part of the discussion we're having about Black health, because an improving representation of racialized health professionals is a key aspect, like the previous speaker just mentioned, of managing this data. So we know that it has impact in terms of the support, institutional and structural changes that is needed in healthcare, the support that we need for those kinds of changes to happen. Data is a key part of that, but managing it is that piece. Gonna move to the next. So where are we now in terms of actual state of data? Yes, we're now collecting data. We must say there's been progress over the last 5 years in terms of funding for Black researchers, but there's still more work that needs to happen in this area. So the collection of data in the Black community across Canada, it's happening, but it's still sporadic in terms of how we manage and control that. You can see the patchwork here showing how it's everywhere. So racialized data is often absent, inconsistent, or inaccessible, because that is the other big part. We're getting this data. We bring in community members to collaborate to collect this data, but how are they using it? Do they have access to it? Do they have access to our data to actually use in the strategic planning they do in community organizations and in the different programs that people are running in the community? Can they easily access this data? And even if physically there's somewhere they can get access to this data, do they have the ability to analyze this data themselves? Do they have the training in terms of data literacy to be able to use this effectively? And some people from the community are actually invited to be at tables where they would be required to give feedback or to provide advice on what needs to happen, but they don't have training themselves to understand what data governance means. So then how would they contribute meaningfully to a discussion at a table just because they come from the community but do not have the training to be able to provide the necessary feedback for that particular discussion at the table? So a dynamic extraction without redistribution is part of the problem that's going on. And then the misclassification of this data, it's all happening together. And that's where we need to come together to really think about data management and how we govern that. This is just a quick takeaways from the result of the study we're currently analyzing. Actually, I see Dr. Misore Dryden there. It's one of the co-PIs of this project. Dr. Josephine and others are all part of this project team, and Dr. Idrissa. So we've completed individual surveys across the country, but also organizational survey, and also we've done individual interviews with leaders across the country to ask about data governance, what it means for them, how they are experiencing it or using it or not in their organization. And we sample organizations that self-identified organizations that serve the ACB community across the country. The individual survey points to, you can see the numbers there. We did 384 individual surveys, and 137 organizations were surveyed, and 30 individual interviews, which is not part of this presentation because we only have 10 minutes. Strong involvement in data collection and analysis, but less in terms of design and actually knowledge mobilization activity, whether it's how we share this information. Again, that speaks to their access to the data we have. What kinds of method are we using in our knowledge mobilization tools that will make it accessible for people in the community to use it for decision making and strategic planning? Governance is seen as important, but current structure needs more attention. There's high interest in training. They want to be trained. They want cultural competence training. They want to understand the methods we use. And this is where I think many people have talked about the need for community-based research, where we have team members, collaborators, learning the process, co-designing the research process. So, participatory approaches for sure. Barriers that they identified in this survey include lack of representation, mistrust, language, and power imbalances. Interesting, power imbalances comes up really strongly too in the scoping review we've done. So we have 4 sets of data: scoping review, qualitative interviews, surveys of organizations, and surveys of individuals. So for the organizational gaps, equity gap was talked about by organizations. So we have leaders of organization complete the survey on behalf of the organization, while here the individuals completed it from their own experience working in these organizations. So race-based research, diversity frameworks, and community involvement is a gap they've identified. The strengths include data analysis, donor compliance, legal standing, all relatively strong in terms of where people feel they can contribute, but commitment is needed in terms of improvement in planning and piloting initiative to expand equity, to strengthen governance, and to deepen community engagement. Again, that's where we're saying there is gap in terms of people's knowledge about what governance means. It took us quite a while to actually reach people that didn't see data governance as something boring, that they don't even know what to do, or a lot of community mobilization before we started getting the result we needed. So data collected from Black communities without little to no community benefit, as it's part of the risk that we take when there's extraction without accountability. Statistical invisibility or misrepresentation is another risk. Algorithms reproducing systemic bias that is in decision making. So we make decisions, again, still reproducing the bias that we're trying to solve when we don't have mechanisms to monitor what we're doing. And so responsibilities, then it's the ethical science or scientific ethics. Researchers must be accountable to the communities behind the data. We cannot just collect data and leave the people behind, because participatory anti-racist methodologies are essential in this way of collecting data. Again, training researchers, analysts, and data professionals in equity and ethics, how we can manage this data in an ethical way, in a way that recognizes the people behind the data, is an important part of this work. So the reality is that good intentions can meet the structural barriers we're talking about. So institutional resistance to structural transformation, we've heard that throughout the day, is a problem. Disaggregated data risk, or is it a risk or a resource? Yes, we can get disaggregated data, but if we're not managing that with input from those behind the data, are we truly using it as a resource to resolve equity issues? Or is it more of a weapon that can create harm in the community? Balancing scientific rigor, confidentiality, and racial justice should be a key part of the data governance. And so towards an anti-racist data governance, we need to learn from indigenous data sovereignty modules such as the OCA principle and community-led frameworks that would create trust, advisory council, equal partnership. We had the IGAD that was developed during the pandemic. Yes, we have that document. How do we operationalize it to get into the equal, the advisory council, the accountability measures, so that it's not just something developed and kept as more of a document that we're not operationalizing and having people accountable. So co-defining priorities, indicators, and benefits with ACB or African, Caribbean, and Black communities is a key part of this process. Okay, 1 minute. And capacity building, training a new generation of Black data scientists and health researchers. It's a key part of this transformation that we need to see. And we need to support long-term institutional transformation in health research, in healthcare and the research itself. Of course, policy integration is a key part of this. How can we integrate the data governance framework or principles within policy so that institutional accountability is part of that process? Budget allocation based on racialized health needs is also a key part. And these are the key recommendations: community co-governance of data, legal recognition of collective data rights, and targeted investment in capacity and infrastructure, as well as, again, transparency and accountability in public health data systems. So in conclusion, governing data is governing lives. And so failing to govern data equitably legitimizes minimize health inequities. And now is the time to assert Black data sovereignty, grounded in justice, science, and solidarity. This is the time. Thank you.
Thank you very much for staying with us. Thank you for that really important, the highlighting of the urgency of sustained targeted funding streams, stronger reviewer training, and partnership models that prevent extraction and center Black communities in the decision making. I want to invite the audience, if you have any questions, can you please present yourselves? You came. Welcome.
Alors, je m'appelle Loydie Jerome-Majewska, je suis doctorante à l'Université Laval en relations industrielles et je travaille sur la souffrance au travail, la santé mentale des femmes noires au travail. La question, j'ai à la fois un constat et une question. Depuis ce matin, on parle un peu de tous les déterminants sociaux qui font que justement les communautés noires ont des difficultés au niveau économique, qui, face à ces difficultés économiques, comment on fait pour intégrer par exemple, des filières où il faut payer, etc. Donc, ça demande un certain coût économique. Est-ce que, justement, il n'y a pas un problème là? Et puis après, quand on entre dans l'institution, donc ça veut dire qu'on a un peu franchi la barrière économique pour pouvoir étudier. Quand on arrive dans des milieux où on propose justement ce cadre explicatif qui est celui de la critical race theory, où, par exemple, on veut, pour pouvoir adresser le problème noir des communautés noires, on a besoin de mettre en lumière, en fait, la structure coloniale, esclavagiste, donc remonter dans l'histoire pour montrer comment le narratif et l'imaginaire s'est construit. Et vous avez en face de vous un corps professoral qui vous dit non. Comment on fait?
C'est la question. Comment on fait? Je ne sais pas.
Oui, c'est-à-dire que quand vous commencez à leur parler d'intersectionnalité...
Oui, je comprends.
Voilà.
C'est un peu difficile. Pas vrai? C'est ça. Est-ce que c'est correct si je reprends en anglais? Oui, d'accord. I think it's difficult. It's a really wonderful question, right? And I think the one thing I think I've taken away from my career is no is always the first response. And I would say the comeback to that is you never take no, right? And so that's where the health inequity and the health challenges come in, because you're constantly saying, no, I'm not taking that answer, so I'm going to come back. And then you come back with proof. And they said, well, that's just your example. So then you get more people, and they say, that's more examples. So let me tell you what worked for me. What worked for me as a student was finding people who may not look like me, but who understood that sometimes I just needed a place to chill, a place to just be me and not deal with whatever is going on and to just do science. As a young person in the field who didn't have money, you have to go to meetings. So you have to take on and find sources of income. Like, we're not from a rich family, so it wasn't like I was going to be going left and right. But you go to these meetings and you find your allies, and you build community. I can't stress how difficult it would be to do any of this alone. Like, I don't know how it is for you, but you know, even when you're the one person, you cannot be alone. Even if your people are not in the building, you have to have your people. And so I would say you build community, you don't take no, and you figure out ways to protect your mental health and your physical health. I really believe that's important, especially for us Black women with our hypertension. Your physical health matters because you can't fight if you're sick.
La réalité, c'est que beaucoup abandonnent.
Oui, je sais, mais c'est avant de partir, chercher quelqu'un, tu peux m'appeler. Je vous donne my number. You can call me. Before
Okay.
you leave, call somebody.
Okay. Thank you.
Good. I just want to add that in addition to what you've said, part of how you cope, having a sounding board is such an important part of how you deal with this. Whether or not the person is from the Black community, like you said, if it's an ally, somebody who can understand what you're going through. But I think also choosing your battles. You have to choose your battles. You can't fight all, or you will not have the oxygen to continue to give and attend all the meetings. Yeah.
Thank you.
Thank you for that question. Do we have any other questions? Yes, we do.
What is he going to ask us?
I know. I spoke a little bit earlier and I spoke way too much. But I really couldn't resist because this is a struggle, and this is a struggle for all of us, actually. This is, and I'm not asking you to respond to this. I'm going to frame it around data justice. And not only the difficulty, but why it's resisted, because it mirrors, it almost gives, it shames the institutions sometimes. So institutions by and large are better being in the dark than in the know. And the struggle where I'm having is, how do we speak about it? And I'm always constantly thinking, and this may answer the student before me, how do we think about conversation through invitation? In other words, how do we invite particularly those who are resistant to data justice into the conversation in such a way that would allow them to see the possibility of that? And I'm thinking specifically about people who are in positions of power and who are decision makers, because that is the struggle that we're all having. And I don't have the answer, and I'm not expecting anyone to think about it, but it's and it's more than a rhetorical question, by the way. So for me, it's a kind of a question that we are all faced with. So by way of answering my own question and thinking about it from how we might think about the student's question, we constantly and always need to think, as W. Du Bois had reminded us many years ago, 1905 to be specific. That's how far it has been as an issue. He suggested that we always need to be bilingual. We need to do double talk. And he frames it around this idea of double consciousness. So in order for us to reach the point where we have a conversation through invitation, we need to do two things at the same time. And this is a kind of my own struggle as a Vice Provost, Equity, Diversity, and Inclusive Excellence at U Ottawa. On the one hand, you need to speak the language of data justice, so being firm about it, firm about the need for it. And at the same time, and I love your how you were going with it, at the same time, showing not only the necessity of it, but the urgent need of it. And it's just a very illustrative example that I constantly do is to offer data that that's in existence. So I take the example of CCWS. This is a survey about the student satisfaction and sense of belonging on campus. It comes from UBC. So UBC that administers that survey. So I take that survey and dig into it and make the admin curious about the survey itself, student sense of belonging. So I have two, and I just analyzed it 3 days ago. Really, really interesting. On the one hand, we have the students with disability who are the least satisfied on our campus. The least satisfied. They're not only dissatisfied, they are pissed at U Ottawa. They have a number of issues with U Ottawa. Other extreme are the Francophones. This is heaven for them. U Ottawa is heaven for Francophones. Students tell us that. They are the most satisfied, they have least issues, and so on and so forth. So I'm giving you this as an example by way of showing, aren't you as admin curious about what is it that we're doing for the Francophones that render them this way? Is there a way for us to duplicate and replicate this for other groups, and so on and so forth? It's just, I'm sharing a little bit, and my apologies for taking the floor a little bit more. I told you, I wasn't asking a question. Good.
It's a good intervention.
Thank you for adding that. That is very helpful.
Okay, so since that wasn't a question, we'll move on to the next question.
OK. Bonjour tout le monde. Je vais poser ma question en français.
Okay.
OK. Mon nom est Venadia Despé. Je suis étudiante au doctorat en santé des populations à l'Université d'Ottawa. Je suis vraiment contente d'être là ce soir et j'apprécie vraiment toutes les interventions. Puis j'ai beaucoup appris sur la santé mentale des personnes noires ici au Canada et j'ai remarqué qu'il y a beaucoup de présentations, qu'il y a eu plusieurs présentations, que ce soit sur plusieurs groupes, les jeunes, les enfants, les aînés, les femmes, des interventions aussi sur la santé reproductive des femmes. Par contre, il n'y a pas eu d'informations par rapport à la communauté des personnes en situation de handicap, par exemple. Et sachant qu'ici au Canada, les femmes, de manière générale, les femmes en situation de handicap sont 4 fois plus à risque, par exemple, d'être victimes de violences. Et si, dans une perspective intersectionnelle, si on réfléchit à la question, probablement que les femmes noires en situation de handicap vivent aussi des situations assez particulières qui mériteraient d'être adressées, qui a aussi des impacts sur leur santé mentale. Fait que je me demandais, est-ce que, au niveau de vos recherches, est-ce que c'est quelque chose que vous avez considéré? Et parce que moi, c'est quelque chose qui m'intéresse. Peut-être que vous pouvez m'aiguiller sur où aller. C'est quoi c'est qui les chercheurs, les femmes noires ou chercheurs noirs qui s'intéressent à la question, qui pourraient comme m'aider au niveau de mes réflexions et de ma thèse. Merci beaucoup.
Thank you for that very important question. I think you raise a clear gap, even in the current work that we're doing. And people with disability, you call handicap in French. Yeah. I personally have not done particulars. Actually, we did one study that looked at healthcare professionals who have disabilities and how they are treated in each of their disciplines. We looked at medical doctors, nurses, social work. And yes, it's so clear, the difference in terms of the experiences. But looking at Black population in particular and the additional handicap that comes with that, I live it firsthand in my own personal life. Having a child that's deaf, I know what the pandemic did. Even it could no longer walk because with mask, you cannot lip read. Even when you're asked, walk behind with only your colleagues, you can't talk to your colleagues, they're all wearing masks. And so, and that adds to all the other issues that we've talked about today that you're dealing with. And so then having a disability on top of that magnifies it is definitely a gap. I'm not sure if there's any one of us that is currently looking at it, but I want to assure you that in my role as Canada Research Chair for Black Women's Health, we are developing a 10-year agenda. You'll be hearing about that, and we are looking at mapping these areas and working as a team across the country to address these gaps that we're seeing in research for Black women. Yeah.
Thank you. Okay. Sorry, don't leave yet. I just also want you to come and see me after, because I am looking at the educational aspect at that intersection of Blackness and disability. And the preliminary analysis are really showing that our community is not being supportive of our children with disabilities. And they're getting diagnosed very late in life. And then on top of that, the family is really kind of more of an obstacle on that aspect. So if you want to come talk to me, I will definitely like to have that conversation. Okay, so we're gonna wrap it up. Thank you so much. It was an honor for me to moderate this last panel. It was a pleasure meeting all of you. And I guess I will pass it over to the wonderful timekeeper.
Chers amis, mesdames, messieurs, je sais qu'on est un peu fatigué en fin de journée, qu'on applaudisse encore très fort ce panel, le dernier de la journée.